Eric, would you now contrast what's going on in some other counties to what Maureen just described in Weston County?
I think it's a good question. And, we've got some definite hotspots in our state. Fremont County, the numbers continue to climb drastically. A lot of it has to do with, I think, what's going on out on the reservation. Teton County, another area of concern. And in those areas, in particular, they're almost the exact opposite. A lot of them are wanting to do the social isolation and the distancing and are really concerned about continuing the spread. But the impact it's having on their economy is staggering, and on the healthcare infrastructure itself.
Could you describe some of those variant impacts on the healthcare system economy specifically? Obviously, we have a sense of what's going on in different areas with regard to, do they have enough PPE? Are they getting support from their community? How many cases do they have? How do they isolate COVID positive people from non-COVID positive people? It's affected elective procedures. How is it affecting hospitals specifically on the economic side?
Well, I don't know if you could describe a better or a more perfect storm. A lot of our hospitals went into this pandemic already struggling financially, and then you compound it with all the things you just mentioned. But elective procedures is really the lifeblood of most of our hospitals, and our hospitals did the right thing. They ceased doing those to preserve PPE, to put safeguards in place. But we're estimating in the first 6 weeks of this, the 17 days of March and then of April, loss of revenue of over $100 million for our hospitals.
Jeez.
Which is, and then on top of that, they're doing all they can to cut expenses while trying to maintain staffing.
Mm-hmm.
There were some real serious concerns early on because a lot of them had no cash reserves, but the reserves they're burning through that quickly to try to keep people employed and to try to have the PPE. We are starting to see elective procedures starting to come back a little bit, but there are a lot of safeguards that have been put in place, and I think it's going to be different in each community. Like Maureen's talking about, Weston County, and there are certain areas that have very low cases where I think elective procedures might make more sense, but then you got these highly infected areas, and you don't know, the number of actual tests that have done and confirmed cases. I think this morning is 444 confirmed cases. There are a lot of people out there that have it, that haven't been tested, aren't showing symptoms and signs. And so trying to put safeguards in place to make sure we don't infect a sterile area. And an example I'll use, I heard of one of our hospitals that started procedures again, and they had a patient that tested negative, and they did surgery on that patient. It actually wasn't even elective, it was more emergent. But then the day after surgery, they found out that the patient was positive. And so
Wow.
anesthesiologists are now out. The surgery staff is out being isolated. And so now they're struggling to even be able to do surgeries, even on an urgent basis as opposed to elective.
Wow.
PPE has become an issue. Our state stockpile really wasn't built for a pandemic. And so when we went into this, the stockpile we had within the state was inadequate for the grandeur and magnitude of this pandemic. And then the national stockpile really wasn't where it needed to be. Right. We've been able to get some supplies in, but mainly our hospitals have been left to their own device to try and work with their own suppliers. We're being gouged. We're paying 5, 6, 10 times the price to buy supplies out of China now. We are working with local manufacturers that have revamped the way that they do things, and they're now making gowns, and they're making face masks, they're making shields. Innovative approaches have come out. 3D printers are being utilized to create masks and to create face shields. The universities, the community colleges have reached out. The public has been great. They've been making masks and donating to healthcare providers. And, we're focused mainly on hospitals here, but then you take a look at long-term care, and their whole business models changed too. They've basically locked themselves down and the isolation for the residents is just, it's almost heartbreaking because they can't see their loved ones. But we're bucking the trend. We have no confirmed cases in our nursing homes, which is such a blessing, but it's so difficult, and we need to stay that course. We see in other states where it started in nursing homes, and it literally decimated the populations of those nursing homes. So I don't know if it could get any worse, but we have been lucky. We've received some really good help from our congressional delegates back in DC. They put together a pretty good package that is finally coming to fruition. Our small hospitals have been able to access the SBA PPP program, which in the first go around they couldn't, but in that second there were some changes made, and Senator Brasso did a lot to fight for us, and so hospitals like Marines now are able to access the PPP. There's a rural package that's coming out this week, and there will be about $99 million coming to Wyoming through that rural package, and that might be the lifeblood that a lot of our hospitals need to make it through this pandemic, this crisis. But we still have a long ways to go too.
Yeah, well, it's so fabulous to have Senator Brasso in Washington, understanding our medical delivery system in Wyoming as well as he does, and then to be positioned to help with things like that. So I'm glad to hear that the response from DC has been what was needed. So that's great news. This has been an extremely helpful, rewarding conversation. If you could look at the next 60 to 90 days in planning for sort of reopening, how do you think that's going to occur within the hospital component of Wyoming's economy and healthcare delivery system? And the question's for both of you.
Well, I think from our perspective, we will be cautiously moving forward. We don't do surgeries here, and so our revenue loss has been in our ancillary areas of lab and radiology and therapy, which, I mean, literally almost went to zero with people just really wanting to stay home. And so now they've got to get back into their physician, to get recertified, to get re-going on their therapies and such. But as the clinics get back going, the other ancillary services will come back. We have been seeing some skilled swing bed coming back to our facility, as well as acute, which are really good payers for us. We just, I think, are being right now being very cautious, and will probably for the next 60 to 90 days plus, because, depending on, when you think the second wave is potentially going to hit, we're going to continue to monitor our supplies and our PPE items to make sure that we continue to follow those, so we're prepared this time when we get to that point. And hopefully again, it won't be in our area the extent that we're seeing elsewhere, but it's one of the things that we do is try to plan and prepare as best as we can. And I think we're cautious is going to be the word.
Mm-hmm. Eric?
I think Maureen did a great job of talking about, we've seen decreases in visits. Our clinics are down, numbers of visits are down 60%, 70%.
Yeah.
I think I talked with one of my hospital CEOs in another part of the state this morning, and they're excited with reopening, but they also realize that it's going to take time to regain confidence in the consumer.
Yep.
And I worry a little bit. People have been having strokes at home. They've been having heart attacks because they're afraid to go to the hospital. And so I think that the fact that we've gone this long without being able to do diagnostic testing, some of the things that we normally do in preventative care, we may end up with a wave of sicker patients as we emerge from this. But I think again, it's going to be different in each community. I think Teton, Fremont may take a lot longer to come back just because they're still battling, and hopefully, if statistics are right, this week or next week is the peak or the spike, and then we'll start seeing the flattening of the curve. But I think it's just going to take time for people to regain confidence to go out and to go about their duties. And then, of course, you go to a healthcare provider, and that even makes you more nervous because that's normally where the sick people are. And so I think it's just going to take a little bit of time. I think one thing I'd say, just in closing, though, I told you this earlier, but the healthcare workers are heroes, and I think that a lot of times they go unrecognized, but they're risking their lives right now and putting their families' lives in risk, and sacrificing a tremendous amount to be able to serve their communities. And I hope they're recognized in the future. A lot of times healthcare workers are kind of taken for granted, and a lot of times we're painted almost as villains, but right now we've got heroes in every single community that are doing all they can to take care of the citizens they serve.